Welcome back to MedScenarios. My name is Ghazi Ali Raza. I'm a medical graduate from Makerere University. Today, we shall be talking about retesting for HIV. In this video, we shall be discussing how to retest clients for HIV, those who are on ART and those who are not on ART, especially the categories of people who need to be retested at specific points of time when they're not on ART. Also, we shall talk about repeat testing for HIV. All newly diagnosed individuals should be tested for HIV before they are initiated on ART treatment. This is called retest for verification. Those who are currently on ART and undergoing treatment should not be tested for HIV until recommended. So the reason why they do not recommend routine retesting for people who are already on ART is because they might get false negative results and the patient might believe that they have been cured of HIV. In this case, they'll stop taking ART altogether, and eventually they'll deteriorate and come back with severe viral load and severe clinical stage of HIV. There are several categories of HIV negative people who need to be retested at specific points of time. For starters, let's talk about those individuals who have not yet tested but have been exposed within the 4 weeks of time. When they come to your office, you test them, that's the index testing, and then you retest them after 4 weeks. Moving on, let's say you have screened your key populations who are at a higher risk of HIV. They come back to you after some time, maybe 3 months, 6 months, a year, depending on their situation. When they come back, you have to assess them, take a thorough history, and make sure that their risk of exposure is reduced. Otherwise, you have to retest them to make sure that they have not acquired HIV. So the next category is of HIV negative persons who are in discordant relationships. These people might have tested initially and they have been found to be in a discordant relationship. It could be through assisted partner notification or any other service. So when they come back to you the next time, whatever time period they must have spent together, and they come to you, you have to retest them to make sure that they have not gotten HIV. And this retesting is done by assessing 3 months of history of their exposure. So now discussing about the pregnant women. They usually have antenatal visits at the hospital. And in those visits, they're usually spaced out at different times depending on the weeks of amenorrhea and gestational age. So let's say the common times at which they have visits are the first trimester, the second and the third. But we test them when they come in for the first visits in the first trimester itself. And if they are positive, you send them for ART therapy. But if they're negative or have unknown status, you test them again in the third trimester. This will help to rule out HIV to protect the infant. Or if they tend to be positive, let's say they were in the window period in the first trimester, and by the third trimester you detect that they have HIV. This can help reduce the risk of exposure or risk of transmission to the neonate. But let's say that there are women who do not come and visit the antenatal clinic. So when do you test them? You have to make sure that they're not HIV positive, right? You have to try to make sure that the risk of transmission to the infant or the neonate is minimized. In this case, you make sure that you test them during labor or during delivery to rule out HIV. This is essential to make sure that we can reduce the transmission from mother to child and eventually eliminate it. So it's essential to prevent transmission to child that we retest these women who are breastfeeding every 3 months until after cessation of breastfeeding. Even after cessation, you make sure that you retest them 3 months later in order to make sure that they were not in a window period, so that we are completely sure that the child is not exposed to HIV. It is recommended to align this retesting schedule with the child's immunization schedule. This will enable healthcare workers to make sure that the mother is tested every time she brings the child for immunization, because it's difficult to convince someone to come regularly to test only for HIV. But mothers who are concerned about their children, they usually give time to come for immunization regularly. That's the best opportunity to retest them again. Now, considering those patients who have been diagnosed with TB, a confirmatory diagnosis, or are presumptive for having TB. In this case, you need to make sure that you retest these patients 4 weeks after the initial test. Initial test is usually done at the time they have been tested for TB to make sure that they do not have a HIV-TB co-infection. In cases where there's TB, hepatitis, and STIs diagnosis in patients, you also need to make sure that they are tested 4 weeks after their initial test. Now, what about those healthcare workers who get needle prick injuries? This especially happens to nurses in particular because they're mostly administrating medications and doing venipunctures. In this case and other cases where post-exposure prophylaxis is required, you need to make sure that they're tested after completing the PEP course at 1 month, 3 months, and 9 months, just to rule out and make sure that they're not HIV positive. Then talking about those patients who are on pre-exposure prophylaxis, not post, pre-exposure. These patients might have different risks of exposures, right? Because they might be in discordant relationships for 6 months or have multiple concurrent relationships or any other reason where they have long-term exposure. In this case, you need to make sure that when they visit you at the clinic, you count 3 months before that visit, assess them, take their history, and make sure that they do not have a high risk of exposure. If they do, you need to retest them. Now, thinking about those infants who have been exposed to HIV, let's say the mothers have HIV. In these cases, you need to make sure that they're tested at between 4 to 6 weeks at the transition from neonates to infants, and also at 9 months, 6 weeks after cessation of breastfeeding, and 18 months of age in particular, because by that point, the testing system changes from DNA PCR to the algorithm. What about those infants, those children actually, who have been breastfeeding even after 18 months of age? What do you do in such cases? In this case, it is recommended to retest them again after they cease breastfeeding at a particular point, and that particular point is 3 months later. Now, talking about those patients who have inconclusive results. Remember, we had made a video for HIV testing algorithm. You can find it up on this link. In that video, we used the national testing algorithm and we discussed what happens if a patient has inconclusive results. You need to retest them after 14 days and send those results to the lab, especially UVRI. Now, talking about children and adolescents between 2 to 14 years of age. In this case, this is a little bit tricky because most children and adolescents have different criteria based on which we can retest them. And it would take another video of its own. It's a long discussion of its own. In addition, we have family planning clients. In these clients, you need to make sure you have assessed them thoroughly to make sure that they're not having any risk. If they do have a risk, then you need to test them. Otherwise, not necessary. In cases where this sexual offense and those survivors of sexual gender-based violence, you need to be very delicate. These people have gone through emotional trauma and they need to be counseled properly before they're tested. Let's say you test them for the first time when they come to you. You need to make sure that they're retested after 4 weeks just to rule out that they do not have HIV positive from being raped or any other offense. Even when it comes to index testing among sexual partners, after their first test, you need to test them 4 weeks later. When it comes to blood and tissue donors, you need to test them 4 weeks later after their first test. Regarding the general population, you should test them once a year depending on their risk of exposure. And they should have not tested for at least 3 months. What I'm trying to say is, let's say the person has tested within the past 3 months. You do not have to retest them again. But if it has been more than 3 months and they have a likelihood of having exposure, then you test them at least once a year. Remember in the beginning of the video, we said that we'll be discussing about repeat testing. Let's discuss it now. So repeat testing is only done in circumstances where you have strong evidence that there might be errors in testing and getting results. These errors can be laboratory or transcription based. Otherwise, it is not recommended to repeat test. And if repeat testing is done, it is to either rule in or rule out any seroconversions. This is actually supplemented with other immunological assays which are performed on the same specimens to give us better understanding of these results. However, repeat testing is only done for individuals in window period if and only if they have a specific recent risk. To sum up everything, we have talked about repeat testing in different categories of HIV negative persons. This is essential to rule out HIV completely and to make sure the person can live a safe and healthy life without being anxious about HIV re-emergence. Thank you for watching this video. Hope it helps you out with your preparation.
If you enjoyed this video, please give it a thumbs up and share it with your friends. You can also subscribe to our channel for more great content. And don't forget to follow us on Instagram, Twitter, Facebook and TikTok.